Welcome to St. Alphonsus, and thank you for choosing us for your healthcare needs. You've made the important decision to have knee replacement or hip replacement surgery. You're ready to embark on a journey that will restore you to a higher quality of living with your new prosthetic joint. The Joint Care Center is a unique, dedicated program within St. Alphonsus Regional Medical Center. Today we'll share with you what you need to know as you move forward toward your life of mobility and reduced pain. You'll hear from other patients who underwent joint replacement surgery. You'll hear what it was like before and then after surgery. We'll also walk you through the process step by step, including preparing for surgery, day of surgery, the surgery itself, pain management and nausea control, working with your coach, physical therapy and group therapy after surgery, and what to do and expect once you get home. First, meet some people who recently decided to pursue joint replacement.
My experience with the Joint Care Center was outstanding. Everything was state-of-the-art. The people were caring. You felt like you were the center of attention. They were very responsive to not only my needs, but the questions that my family had. And I felt like it was absolutely the right thing to do. One of the things that I really want to be able to do is to take my grandkids hunting, fishing, hiking, experience some of the things that I loved to do when I was younger. And you need good joints to do that. You know, one thing the surgery didn't correct was my slice.
I had surgery on my hip June 21st of this year. I've tried every weight loss program there is, and I can't do the physical fitness for it. So I've walked with 2 canes. From the time you walk in the door and don't know where to go, to every single physician that answered every single question with a smile on his face. There's just a general atmosphere of quiet, calm, friendly competence. And I would never ask more than that. This is my improvement. This is my quality of life improvement. I can walk without canes.
I had an injury years ago, 25, 30 years ago. It recovered really quite well, and for 25 or 23 years anyway, it was quite good. And then it went really bad, and it hurt all the time. From the absolute start to the absolute finish, to having the procedure, to the group activities, to do the physical therapy, to the follow-up for about a year. Every single piece of it was excellent. The good thing is the pain was gone right away. So as soon as I even woke up in the hospital, it was better instantly. I mean, that alone is you really can't believe it. I just can't imagine a better experience from the very start to the very finish.
Hello, my name is Ben Watland, Joint Center Coordinator and nurse here at St. Alphonsus. When you arrive to the hospital the morning of surgery, if it's prior to 7 in the morning, you may park right out in front of the main entrance of the central tower. If it's after 7, our valet service is available to you. Come in the front doors, check in at the front desk where someone will greet you, and then direct you to the 2nd floor, which is where the surgery waiting area is.
This is the area you'll come on the day you're having your knee or hip replacement surgery. We'll check you in our waiting room. One of our assistants will walk out and get you. We'll help walk you back here. We'll get you in a room, we'll make you comfortable, and we'll start getting you ready for your peri-op experience.
Once you're done in the pre-op area, the patient will be wheeled into the OR suite. OR time is typically about 2 hours.
As we go down the hall, you'll notice that it's a little cooler. That's normal for the ORs. As soon as we get there, we'll have some warm blankets for you. As we walk into the room, you're going to notice a lot of people a lot of equipment. It may look foreign, it may look a little scary, but be assured that they're here for your safety. We have you on the OR table. We've given you some warm blankets. You should be comfortable. Now anesthesia is going to give you some medications. You'll slowly drift off to sleep, and when you wake up, your surgery will be complete and you'll be in the recovery room.
Once your surgery is over, you will be taken to our recovery room. In this area, you will be monitored and cared for by our nurses until you are awake and comfortable. After your stay here, you will be transferred to our orthopedic unit.
After recovery and shortly upon arrival to the 9th floor, you may see a therapist at your bedside to get you up and moving and begin your recovery process. Do expect to see a lot of your nurse and CNA for the first 24 hours, as we are going to be checking vital signs, managing your pain, monitoring your equipment, and making sure you're progressing as you should. We'll start you slow on your diet with things such as ice chips, sips of water, clear liquids, and things of that nature until your bowels start to wake up. Your nurse will help you advance your diet as you can tolerate it. The morning after surgery starts fairly early with some blood work that needs to be drawn. Shortly after that, your nurse is going to come in. We're going to take the drain out, remove your catheter, also change your dressing. Followed by that will be a therapist coming to your room, getting you up out of bed, up for a walk in the hallway. We'll bring you back to your room, sit you up in the chair, and you'll have some lunch. Our first group therapy class will be that afternoon from 2 to 3, and then another individual therapy session after class to end the day. If you're still here on the second day after surgery, things will look similar to the previous day. The only difference would be classes from 10 a.m. to 11 a.m. Everything from that point on will be individual therapy and nursing care until you're ready to be discharged from the hospital. During your stay here, it's important that we manage your pain as best we can. It's important to keep that pain at a tolerable level. We measure your pain based off a pain scale, going from 0 or no pain to 10, the worst possible pain. We'll ask you to rate your pain on that scale, and then we can adjust your medication to keep that pain at a tolerable and reasonable level for you. Other relief options to pain would be rest, ice, cold therapy, and anything you can do to distract your mind from focusing on that pain while the pain medication kicks in. It's important that you keep up in communication with your nurse to let us know how you're doing with your pain management. Nausea is another important factor for us to manage while you're here. While we realize this doesn't occur in everyone, we do want to know if you're starting to experience any signs and symptoms of nausea. We will give everyone a dose of IV anti-nausea medication the morning after surgery, but if it does persist even beyond that, let us know as soon as possible so we can better help you. Preventing blood clots after this surgery is important. We do so by 2 different prevention methods. The first would be a mechanical device such as a foot pump or antiembolytic stocking. The second method of prevention would be a medication or anticoagulant that's prescribed by your physician. Signs and symptoms of blood clots include calf pain, chest pain, or shortness of breath. If you notice any of these symptoms, please notify your physician right away. Infection prevention is also important after this surgery. We will give you 3 preventative doses of IV antibiotics during your stay here. We'll also practice good hand hygiene as a staff and show you how to practice that at home. We'll also show you ways that your physician would prefer that you care for your incision after this surgery. Signs and symptoms of infection do include fever, chills, if the area around the incision is really red, if the area around the incision is very hot to the touch, along with increased pain. Also want to make note of any increased drainage or pussy drainage coming from that incision. Again, if you notice any of these symptoms, please notify your doctor right away. Another important piece to consider is good bowel preparation. We recommend that all patients start on a stool softener at least 3 days prior to surgery. We'll continue that here in the hospital, and we ask that you continue those stool softeners at home as long as you're on any narcotic pain medication. This will help reduce any complications or risks of constipation after surgery. Having a coach throughout this process will be very beneficial to you as a patient. The coach should be an able spouse, a family member, a significant other, friend, or even neighbor. The coaches will be asked to participate in this experience with you so that they know how to best help you after discharge from the hospital.
Hi, I'm Rebecca, and I am one of your physical therapists here at St. Alphonsus Joint Center. And I'm going to tell you about the exercises that we want you to do before you come in for your surgery. The first one we're going to do is ankle bumps. And this one is really simple. It's simply just moving your feet back and forth, back and forth. This exercise is very important for you to do, especially after you have surgery, because you're at an increased risk for blood clots. And this simple movement of your ankles is the #1 way to help to prevent blood clots. The next exercise is glute sets, quad sets. For this one, you want to take and squeeze your bottom muscles together like you're squeezing a penny between your cheeks, and at the same time, take and tighten up your thigh muscles so you're locking your knees into extension. Then I want you to hold it for the count of 5. 1, 2, 3, 4, 5, and relax. But I don't want you to hold your breath while you're doing that. So if you find that you're holding your breath, please count out loud. If you count out loud, you cannot hold your breath. The next exercise in there is short arc quads or sitting knee extension. This one can be done either laying down or sitting up. If you want to do it laying down, you can take and do like we have. Take a couple of towels or blankets, roll it up, put some tape around it. Put that underneath your knees. Then you simply straighten one or both legs. Hold it up there for the count of 5. 1, 2, 3, 4, 5, and then gently lower it down. If you want to do that sitting, just sit up straight in the chair, then straighten one or both legs again. Hold it for the count of 5. 1, 2, 3, 4, 5, and gently lower it down. Okay, the next one in there is hip abduction. For this one, you can use a plastic bag. It will help your leg to slide easier. So for this one, you just want to take your leg out to the side and back in. The next one is heel slides. With heel slides, you can use this plastic bag underneath your heel to help it to slide easier. Then you simply slide your heel towards your bottom and back down. If you're having your hip replaced though and have hip precautions, we want you to take and put your hand like this. When you can put your hand on your kneecap, that is as close as your knee should come to your chest in any position. And that's a good way to gauge that 90-degree roll that you have, okay? All right, the next exercise in there is straight leg raises. And with this one, you want to take and tighten up that muscle on the top of your leg, locking your knee into extension, then simply lift with your toes first and gently lower it down. We don't want to see you do like this, and don't want you to go like this, because that is not a straight leg raise. Okay? All right. The next exercise is armchair press-ups. And after you have surgery and you don't want to put all your weight on one of your legs, it's going to go through your arms. So anything you can do to strengthen your arms before surgery will be to your benefit after. So you want to sit in a chair that has armrests like this, then lift your bottom up and lower it down. A couple of things I don't want to see you do with this one that I see really common is people put their arms back and they go like this, and that's not an arm workout. Or they simply rock forward like this. So that's the last of your exercises. So now let's talk about walkers. If you are going to be buying one from a secondhand store or borrowing one from somebody, there's a couple of things that you need to know about the fit. They are adjustable, but within a limit. So you need to stand with your feet about shoulder width apart. Rest your arms down at your sides. The walker should hit you at about the wrist crease. That gives you a little bit of bend in your elbows so that you can lift your body up when walking. You've just seen a brief synopsis of how you can prepare for your joint surgery.
Hi, I'm Wendy. I'm your occupational therapist in the Joint Care Center here at St. Alphonsus. We're going to talk a little bit about some adaptive equipment that you may need after having a total hip replacement. But first, let's talk about what precautions that you have. There's 3 of them. The first one is don't cross your legs. Don't cross your ankles, your knees, any part of your legs. You want to keep them apart. The next rule is no twisting. Keep your shoulders and hips lined up. And you don't want to bend your hip past 90 degrees. When you're sitting, 90 degrees is this. And so you don't want to reach or bend any farther than what you can reach your kneecap with the palm of your hand. With those precautions in mind, let's talk about how you're going to put on pants. Anything past your kneecaps you can't reach unless you have a tool. The first tool is a reacher, something you're probably familiar with. We use it for reaching high, reaching low. We're going to use them for putting on pants. When you get dressed, you're going to pinch the waistband of your pants, lower your pants down, making sure you're not bending over, and you're going to pull it up to your kneecap before you reach it with your hand so you don't bend past 90 degrees. You'll find that you may need the reacher also for your other leg to make sure your torso is not bending over. The reacher is also helpful for taking your socks off. I like to use the stiff tip. I push the sock off my heel and take it off at the toe by pinching it. For putting your socks back on, you may need a tool. Well, with a hip replacement, you will need a tool. These are sock aids. This one's a little firmer material, this one's a little more flexible. They both work the same. You pretend it's your foot up here where you can reach it. You pull the sock up to the edge here. Make sure you hold at the ends of the handles and that you're not bending forward. Toss it out, put your sock on, and pull on those handles until your sock comes on. You'll also find putting on shoes may be difficult, as you can't reach your finger down in the shoe to put it on. So the long-handled shoe horn will help you put your shoe on this way. We're going to talk a little bit about how you should get in and out of a shower stall or a tub. Let's start with the shower stall. So when you go to get in the shower, you're going to back up until your heels touch the lip of the shower as well as your walker. You're going to step over that lip with your good leg, your non-surgical leg, and then with your surgical leg. You'll reach back for the chair and have a seat. If you have a knee replacement, this might be a little tight for you and your knee won't feel very comfortable bending that much. You may choose to put your foot over the edge or angle it more in the corner, whatever's more comfortable. If you've had a hip replacement, you want to be careful that you're not bending at the hip too much. Let's talk a little bit about the features of a shower chair and what's important. They should be adjustable height in the legs here. You want to make it as tall as you can get it, that when you sit in the shower or tub, that your feet still touch the floor. It's important to have a back on it as well for safety. So you would sit in shower, you would have a handheld shower hose to bring the water to you. When you're done, you'll dry off. Your walker should still be outside of the shower stall. You'll push up with your hands off the chair, reach for the walker, and step out with your surgical leg first, and then your non-surgical leg. Now let's talk a little bit about the tub. It's a very similar scenario. You'll put the chair just inside of the tub. When you go to sit down, you want to make sure you reach back for the back of the chair, kick out your surgical leg, reach back, and have a seat. I usually like to turn the walker so it's out of my way, but I have something to hold on to. And then we're going to swing our legs into the tub. If you're a hip patient, though, you need to be careful that you don't bring your leg in like this so you're overbent at the hip. 90 degrees is all you're allowed. So you want to straighten the knee and bring your foot inside of the tub this way. You'll do all your washing. When you're done, you're going to swing your legs back out of the tub, again being careful not to overbend at the hip by having your knee straight. And then your good leg, you'll bring the walker around. The chair is sometimes a little unstable, so be careful that you hold on to the back of the seat or have someone with you so it doesn't tip you out of the tub. Again, your surgical leg is forward. You'll push up to stand, and you're finished. This is a raised toilet seat. It's a great tool for getting on and off the toilet when your knee is tender after knee surgery, and your hip, you're not allowed to bend past 90 degrees, and most toilets are too low. This is just a brief overview of information we're happy to share with you before, during, and after your stay at St. Alphonsus.
I'm Amy. I'm your physical therapist during your stay here. We've all met already. So this is our first of 2 joint camp classes that you're going to spend with me, in addition to all the one-on-one time that we're going to spend together. Arms are back, knees are pushed down, squeeze your buns. 2, 3, 4, 5, and relax. Slide in, relax. Toes and kneecap are straight up towards the ceiling, on the outside of your hips. Good.
If you find that you can't quite get down to your knees, then you're going to use a reacher. You're going to pinch the waistband here, and you can walk that foot again and get it to where you can reach it. And then you can pull it on the rest of the way. Walk it along. When you stand or sit, you're going to kick out your sore leg first. It's just so much more comfortable than this big bend in it. So you're going to kick out your sore leg, and just watch, don't do it yet. We'll push off the chair, and you'll get to where you're balanced enough that you reach for your walker.
The discharge process starts even before you are admitted to the floor. Our discharge planners will be in to see you when you arrive to the unit. Their role will be to assist you in ordering any necessary equipment that you will need after you go home. They will also help arrange for appointments, for labs, and therapy if needed. They will remain in contact with you, your nurse, and physician throughout your stay to assist with any needs you may have after discharge. There are some goals that need to be met before you are safe to go home. These goals include being independent with certain activities such as walking, transferring in and out of bed, up and down stairs, and others. Once these activities have been accomplished and your pain is manageable, your physician will make the decision to send you home. Once the decision is made to discharge, your nurse will gather the paperwork, go over the discharge instructions with you, and answer any questions that you may have. It is important that you make arrangements for transportation and help at home prior to coming in for surgery so we can have a plan in place for you before discharge from the hospital.
Thank you once again for choosing the St. Alphonsus Joint Care Center. We are always here to answer any of your questions, and we're confident you will find your experience here positive and effective.